Sun, here comes the sun.
He does a beautiful job. Who's going home? I'd like to welcome you all here this evening. My name is Ray Carlson, the Secretary of the Eastern Ohio Pharmacists Association. It's nice to see such a nice crowd here. Our goal from the very beginning was to loosely network the 900 pharmacists that we have in our area, and 500 of those 900 have joined through membership, and we have a significant number of those who have donated time and money and donations to help us get off the ground. And seeing these numbers here, just can't thank you enough. It's my pleasure to introduce President of EOPA, who is going to be the MC tonight. As all you know, is Paul Witkowski. Paul is the pharmacy director at Alliance Community Hospital. And I'm not going to go into any of the details on, because I'm sure he probably has a few things to say about his background. But thank you again, and Paul.
Welcome. I'd like to officially call to order the spring meeting or the annual meeting of the Eastern Ohio Pharmacists Association. Okay, let's see. As our first order of business on here would be the swearing in of our trustees. And one thing that we're very excited about is the broad participation within the 6-county areas. Is that we have a trustee representative from each county. And I don't think everyone is here today, but let's see. Doreen Scheck from Columbiana County. Doreen, are you here? Oh, okay. Please come forward. Rich Frenchek from Mahoning County. Our board trustee from Mahoning. Arian Austin, please come forward. Our board trustee from Trumbull County. You can come up here. We'll bring you up here. Okay. Denise Cousins for Lake County. Diana Goebel from Geauga. And is Robin Guder from Ashtabula. Y'all please raise your right hands and repeat after me. I solemnly promise to uphold the Constitution of the United States and the bylaws of the Eastern Ohio Pharmacists Association. I further promise to assume the duties and responsibilities of a trustee of the Eastern Ohio Pharmacists Association. And to serve in this office in a manner which will reflect credit on this association, its individual members, and the profession of pharmacy in general. To this task I am dedicated. Congratulations. I'd like to welcome our distinguished guests at the head table tonight. Next we have Ohio Senator Joe Schiavone, and people I know and talk with all the time and want to get here and get nervous on the whole thing. Antonio Chacha from the Ohio Pharmacists Association, Sergeant Larry McLaughlin from the Mahoning County Sheriff's Office, and Joe Sabino, who will be who's currently treasurer of Ohio Pharmacists Association, right, who will be giving us our law CE this evening. So welcome, and we're pleased and honored to have you on campus. Our first order of business on here is in your packets you've received, and you should have also received this as a mailing, is an amendment to our bylaws. Or let's see. Yes, so I'm not going to take the time. We have a big meeting tonight. I'm not going to take the time to read that. It's a couple of procedural issues of something that when we were putting this together, there were changes in the offices that we have. So this is to amend Article 4 and amend Article 5 on standing committees. So let's see. Procedurally here, do I need a motion to recommend to approve these changes?
So moved to amend.
Ray motions. Can I have a second on that? Okay. And let's see. Any discussion? Hearing no discussion, can we have a hand vote of those in favor? Raise your hand, say aye.
Aye.
Those opposed, raise your hands, nay. Passes unanimously. Thank you. And again, that was more of a housekeeping issue of straightening up some things that we had there. Okay, let's see. Our next order of business in here would be our treasurer's report. Ken Corin, can you come forward for our treasurer's report?
Of the approximately 900 pharmacists that we represent, we've had 502 actually sign up to be a part of the Eastern Ohio Pharmacists Association. Of those 502, we have 175 paid members, or 34% have paid their voluntary dues. At this time, we have $6,785.69. For those of you who have not paid dues at this time, they are truly voluntary, but we certainly would appreciate them. You're also aware that the dinner this evening is at no charge to any of you. However, there is a donation box. If anyone would like to put in 5, 10, whatever the amount you feel comfortable with, we would also appreciate that. This all goes to work on your behalf. Thank you.
One housekeeping issue too that I should mention, you'll find on each of the tables a paper to sign the information officially for the CE presentation. This is an hour of Ohio CE, plus it's approved for Ohio law. And so that is the most important piece of paper at the end of, we're doing the CE presentation at the end of the program because there's a lot of pharmacists that we were told it's going to be late before I get there with stores closing and whatever. So we want to get this so that you're familiar with the paperwork on here. That piece of paper is the most important piece of paper. That's what's reported to the board, and that's what officially lists you that you got the CE. The certificate that you will get when you hand in your evaluation form is your record of it, but if that record is not accompanied by the information that is on that signature sheet, all of that information, then you have not officially received that CE certification, and that won't be listed with the Ohio Board of Pharmacy, so we can get that out of the way. Okay. Okay, I'd like to do a brief president's report. 1 year ago, there was no active EOPA. Today, as Ken just reported, in our 6-county area, a substantial number of the pharmacists that are practicing in this area have signed up and are members of EOPA, which is absolutely phenomenal. And I want to thank and congratulate our secretary and Ray Carlson, who has personally visited a number of pharmacies and made the personal invitation. And you see what a difference that makes as opposed to sending out an email or something. Who would be interested in coming? That's very, very important, very significant. So Ray, thank you very much for the many hours that you've put into
Also, Denise made visits too up in
oh,
along
okay.
the lake.
And and our new trustee, Denise, has made a number of visits, Ray, saying up in Lake County, and these things are so significant, as we know, that face-to-face contact is so significant. Want to take a moment here is that as the organization kind of died out in here, I saw a documentary a few years ago, and it was on the rise of the NBA actually, and it was called On the Shoulders of Giants. When I was a young pharmacist, a younger pharmacist in the area, I really envied EOPA, what a dynamic organization that it was, the dedication of the pharmacists that were involved. I would like to see in the room anyone that is here who was a member of EOPA year 2000 and earlier to please stand. Ladies and gentlemen, we are here today on the shoulders of giants. That was the story. That was the title of the story that we had before on here, and it is this organization here that as it's coming back into life now, you are the individuals that were very significant in what I saw as a younger pharmacist in the pride and the enjoyment in the practice of pharmacy in getting together as an association, not just as a means of friendship or camaraderie, but actually seeing the importance of coming together as pharmacists and how big that was in the profession in the 1960s, 70s, and 80s. Starting in the 90s, that started to die out a little bit. But so we are here tonight on your shoulders, on the shoulders of giants, and we thank you for your dedication to the profession in the decades past. Thank you very much. Really in there, yeah, the apathy and complacency hit pharmacy association membership hit it hard, and we lived through the decades of 0% unemployment, the sign-on bonuses that were around, multi-$1,000 bonuses. I think pharmacists began to look at the time commitment and extra work involved for active association membership, and especially taking leadership positions, as not having much of a return on investment for their personal time. I think many pharmacists began to look at association membership primarily from a focus of what's in it for me, what do I get out of it? And maybe it was, well, I get some CE, I get some free dinners from drug companies, and other than that, is it really worth my time? And the whole membership, not only EOPA, but in many organizations. I was a member and past president of the hospital association in town. My wife was big in the women's affiliate, the Women's Pharmaceutical Organization, and all these organizations died out. So some of the things that we have now that are going on, we will soon likely see a much more difficult market for pharmacy graduates in the future as there aren't nearly the number of new positions opening up. We as a profession have a responsibility to create new markets for what we do. The schools of pharmacy are providing a great lead into that. And when I say new markets, I'm not talking about waiting for the chain stores to build more pharmacies, but for new areas that pharmacists can have key roles in. I see opportunities in integrating in physicians' office practices, in clinics, in medical homes, accountable care organizations, helping to provide superior patient outcomes through our participation in collaborative drug therapy management. I know in my own hospital right now, the director of emergency medicine is coming to me and saying, Paul, I need a pharmacist in here. When I see a patient comes in, he's got 26 medications that he's taking, I have no idea where to start. I want a pharmacist in here to figure that out for me and to come up with what may be going on, what am I seeing here, because I don't know where to start with those patients. So the need is there. We're just trying to put it together economically. So that's why I say is that I think we need to work on developing new markets. We can't do that, and we can't do that individually. We can't do that as individual pharmacists. But when we come together, and when we come together as a big group of people like we are here, just in one little corner of Ohio, we can start to put some ideas together and have a little bit more influence in how these things go together. Our key role in society will always involve how patients obtain their medications. Obviously, the dispensing of prescriptions will always be a big the primary focus of our profession, and things that we're seeing there through the PBMs, and a lot of very exciting and promising things that I'm seeing now coming about with PBMs, is how much time as we as pharmacists can spend with patients when our compensation for filling a prescription might be the MAC cost of the drug plus 50 cents or plus 65 cents. We can't do it for that. We can't give the amount of education and time to patients that we need to be able to do that. So then again, individually, can we do anything on that? No, we can't. I know I'm signing contracts like this because I have no clout. I can't tell Express Scripts or whatever that I don't agree to your terms here. I just have to sign them if we want to accept that into our practice. So alone we can't do that, but together we can. I believe the success of the ORS program on here has dramatically reduced the amount of prescription narcotics that are being diverted out into or available into the illicit trade. Some of what we've done is we haven't reduced the demand, we've just shut down the spigot from legitimate prescription drugs. So now we're seeing this alarming increase in the amount of heroin use, of deaths, of issues, and those are some of the things that our panel tonight, our program will be talking about and focusing on. As I mentioned to some of you here, is personal connection. One of my pharmacy technicians, her niece is a pharmacy technician in Virginia Beach, and on April the 15th, she was in the back room of the pharmacy and heard a pop, and came out into the pharmacy, and the pharmacist said to her, "Kelly, call 911. He had been shot." She started administering CPR to her pharmacist, and 2 hours later he was pronounced dead. That person who accosted that pharmacist left that pharmacy, went to another pharmacy, stuck his gun in the belly of another pharmacist, did not shoot that pharmacist, but held up 2 pharmacies in one day. The desperate behaviors, the desperate nature of people with addictions is something that certainly affects us, affects our profession. So those are 3 areas there that I wanted to mention as a President's Report. I am so pleased and so proud of so many pharmacists coming together, because alone we can't do this. Individually we can't do this, but together we can, with the help of our legislatures, with the help of law enforcement, we can put some ideas together and say, hey, these are some things we need. Not for us, not whining and saying, oh, us poor pharmacists, look at us, woe is us, but that for us to really serve the patients, the residents of Ohio, the residents that we deal with in our own communities, to improve their health and safety, there's some things that we may need to work on. So that's where pharmacists that you know that haven't signed up, that are in the area, please encourage them to come together, because the more voices that we put together with our county representation, with our board trustees in the various counties, we're working to make this to be a very, very cohesive and collective thought process as far as how we can improve things and make them better. Okay, so that's my President's Report for this evening. Okay, going to program, the next order of business is Ray was in contact with U.S. Senator Sherrod Brown's office, and there was a lot of talk and a lot of emails going back and forth as the Sherrod Brown's office was looking to see if we could make arrangements for him to be at our program. As it ended up, he was unable to attend, but he did provide us with a video greeting.
Thank you to the Eastern Ohio Association of Pharmacists for inviting me today. You have a critical role in improving the health of Americans and patient care, dispensing medication, all the work you do. Thank you for that. With prescription painkiller abuse on the rise in our state and the growing theft of these drugs from pharmacies, I've introduced legislation that will help crack down on drug robberies and stiffen the penalties for pharmaceutical theft. This will help to keep prescription painkillers off our streets and out of the hands of abusers. It will also help protect pharmacies and your employees from being targeted in these far too often violent crimes. We need to continue to work together to make prescription drugs more affordable for every Ohioan. by closing the donut hole gap in coverage for senior prescription drugs. The Affordable Care Act has saved Ohio seniors an average of $964 on their medication costs in 2013. There are even more common sense solutions we can work towards, allowing HHS to negotiate bulk discounts the same way the VA does for our veterans. We should do that for Medicare. Community pharmacies play a critical role in our healthcare system. It's unfortunate that flaws in the Medicare Part D program put an unnecessary burden on so many of your businesses. That's why I agree that it's the role of pharmacy benefit managers who administer Part D, that as that continues to grow, we need to look at ways to provide for better transparency. Opening up Part D networks to allow any willing provider to participate and utilize preferred cost sharing will allow you to better serve your communities. So I hope at this meeting you'll collaborate with your colleagues and share best practices and find ways to strengthen your advocacy. Please work with my staff if you have suggestions on how we can continue to improve healthcare in this country. Thanks for inviting me to speak. Most importantly, thanks for the work that you do for our communities in Ohio.
All right, the next order of business on here is have an OPA report from Antonio Chacha. If you could come to the podium and give us an update.
Thank you for having me, Paul, and thanks for making me feel so short. I appreciate you all having me out here today. I was at the meeting last year, and I was blown away by the numbers. And as I drove home, I was like, well, good shot out of the box, Ray. We'll see if it sticks. It obviously did stick, so congratulations to you. I know you put in a lot of hard work on this, and thank you all for being here. I complain a lot about pharmacist participation in the process, not just with that advocacy, but just any kind of involvement. Across the country, only a third of pharmacists belong to anything. That's not just OPA, that's APHA, NCPA, ASHP, you name it. There's a lot of apathy out there, and I like seeing this out of Eastern Ohio Pharmacists Association because I think that apathy is finally being cured. And sometimes it just takes you getting bothered enough to finally say, hey, we need to get involved and do something about this. A little bit about my background. I actually started in pharmacy school at Ohio State University after a year and a half, and as I worked as a technician for Mark's Pharmacy up in Cleveland, I said, this is not for me. I don't think I could stand around and answer dumb questions all day and stay on the phone with insurance companies all day. That was just, I did not see a good light at the end of the tunnel, so I got out. I switched to political science and eventually graduated. I thought it was a pretty good fit to join up with Ernie Boyd over at the Ohio Pharmacists Association, and I started doing government affairs for them last year. So I get to work on a lot of the problems that initially pushed me out of the profession, which was insurance companies, pharmacy benefit managers, low reimbursement basically costing you all and pharmacists to keep their heads down all day. The business model of pharmacy has to change. So that's what we're trying to work on at OPA. A couple of the bills that we're working on, and I know Senator Schiavone is going to talk about them, you're lucky you've got a great speaker today because he's very pro-pharmacy and he's a great advocate for you down at the State House. I bother him a lot, but it's really not that bothersome because he actually agrees with me most of the time, so it's beautiful. One of the bills we were working on earlier, this began early last year, was House Bill 44. That's emergency dispensing legislation. So in times of chaos, if there's a power outage, if there's a terrorist attack, an outbreak, you name it, anything that would disrupt the normal flow of medications to patients, that bill would essentially allow pharmacists and pharmacy interns the ability to service patients and exercise their humanity. What it does, it allows you to dispense limited quantities of dangerous drugs to patients using your own professional judgment. So you don't need a prescription record because obviously in times of emergency, how easy is it to go in to get a doctor's prescription? It's hard enough getting into the doctor's office. Imagine in times of emergency. This allows you to, as I said, exercise your humanity. That bill passed the House, passed the Senate, was signed into law in March. So, all right, there's one off the list. The other bill that we're working on is the immunization expansion legislation. That's House Bill 394. That's a bipartisan bill sponsored by Representative Ryan Smith and Representative Nikki Antonio. That bill will allow pharmacists and pharmacy interns to administer all CDC recommended vaccines to patients who are 7 and up. You can imagine there might be a little bit of opposition to that bill. Yeah, there is. Pediatricians are not happy. They're afraid that you are encroaching on their turf. What we see is a mumps outbreak at Ohio State University that has now gone up to over 200 people. I mean, mumps, really? This is 2014, mumps should be gone. We think that you all are more than competent to administer immunizations and to complement the efforts of our pediatricians and physicians in the state of Ohio. There are currently over 650 designated medically underserved areas in the state of Ohio. So that means that physicians, PAs, nurses, whatever, they're not there. So you all are instrumental in essentially serving and filling in those gaps. So House Bill 394 passed the House 82-7. It's a good ratio. And right now it's over in the Senate Senate Medicaid Health and Human Services Committee, where we're awaiting hearings. One of the other bills we're working on is Senate Bill 240, that is consult agreement languages, sponsored by Senator Dave Burke, who's a pharmacist. And what that will do is change consult agreements. How many of you are currently working in a consult agreement with a physician? Nobody. Oh, well, I got a newsflash for you. I'll teach you about it. So right now, the physician is the expert on the diagnosis. You, the pharmacist, are the expert on the drug. So what we're finding with a lot of high maintenance disease states like diabetes or hypertension, things that involve a lot of fluctuations, a lot of readings, things like that, the physicians are asking pharmacists to take over. They're saying, you know the drug better than I do. Change the dose for me. Or is there another drug that would be better for this? What should we be treating this patient with? So we have a lot of pushback from the medical community on this bill because it does a couple things. What it does is it eliminates a lot of the red tape of current consult agreements. So the reason that a lot of you probably aren't operating in them is because they're really, really difficult to get into. They involve a lot of paperwork and a lot of red tape, as I said. This bill strips all that red tape out and allows pharmacists to have multiple agreements with multiple physicians to manage multiple disease states for multiple patients. So it really opens things up. It also allows you to order blood work and to analyze that blood work and to act on that blood work. Lastly, it allows you to prescribe under a consult agreement. So if a patient has diabetes and the physician says, I trust my pharmacist to actually manage this disease state and not just recommend changes to the drug, I want my pharmacist actually prescribing those changes. This is very progressive stuff, and it's really going to open up a lot. I was talking to Tim Abraham earlier about this. There's a lot of opportunities in this because as outcomes are more and more important, you all are going to be essential for improving those outcomes, making sure the patient isn't going back into the hospital. Last bills that we're working on are pharmacy benefit manager reform. Some of my favorite things to work on. Because according to the pharmacy benefit managers in the state of Ohio, they're already regulated enough. Anybody disagree with that? Okay, thought so. We're working on one bill right now, which is Senate Bill 258. It's a pharmacy audit bill. I was in a pharmacy, it's now months ago, it feels like it was forever ago, but that pharmacy had a prescription called in by a physician. The person in the technician in the pharmacy took all the information over the phone, typed it in. The patient got the right med, right patient, right dose, right instructions. Everything was great in this prescription. Except the PBM came back on an audit, this was 2.5 years later, and said, I want to see the record for this drug. It just so happened to be a high-priced drug, can you believe it? And they said, let's see it, and let's see the other prescriptions around it. And they looked at it and they said, oh, you had everything right on it. However, you didn't get the last name of the person who called it in. The PBM took back $1,300 on that drug. Any refills on that drug, those go away too. If you have a complicated last name like mine, Chacha, take a guess at how you spell that one. If you screw that up, the PBM can come back and take back all that money as well. I know some pharmacists are really, really helpful for their patients, and for the patients that receive a lot of different medications, they'll actually put on the label, this is for pain, this is for indigestion. If that isn't on the original script, in the PBM's eyes, that's an invalid script, and they'll take back the money for that too. Thanks for helping. So this bill would would prohibit PBMs from taking back money for typographical errors. It'll put limits on how far back they can go in an audit, because right now there are no limits. I had one pharmacist say that they went back 6 years on an audit. Thorough. This says they could go back 2 years, and they have to give you a little bit of notice before they come in, because obviously you don't live to serve PBMs. That bill passed the Senate unanimously, so that means we're fighting the good fight. And it's over in the House, and we're awaiting hearings on that bill as well. The other piece of legislation that has yet to be introduced, we're working with Representative Cliff Rosenberger and Representative Jack Serra, and that bill will give PBMs a little nudge on updating pricing on their MAC lists. Currently, does anybody know how often a PBM has to update their MAC lists?
You don't have to.
They don't have to. They don't. So you might be filling a drug, and let's say the cost of the drug, we're seeing a lot of spikes in generics now. Can you agree with me? The cost of that drug goes way up. The PBM doesn't update their MAC list for 7 months, 8 months. You take losses on that drug until they update it. There are so many things that you all are doing in pharmacy that is real time or overnight. These companies, I mean, we're talking about one that's on like number 24 on the Fortune 500 list. Do you think they could handle maybe updating their prices nightly? Our bill asks for weekly, and they're really upset about it. So that just shows you a little bit what we deal with on a regular basis. We're trying to institute some very, very basic PBM reforms, and we're getting a lot of pushback. What I ask from each and every one of you is to do what I could say I know of a handful, and I'm sure I don't know about all of you, but I know I look at a few people in this room that I recognize that I probably see too much of. Because they're always coming down to Columbus, and they're always helping me out, and they're always meeting with their legislators. Senator Schiavone has been pestered on this PBM issue ad nauseum, and it's a good thing, because he's learned a lot about it. There's 32 other senators out there, and there's a whole slew of representatives that I need you all to educate. At the end of the day, I represent you, but I am a lobbyist. And what do people think of lobbyists? My dad likes me, that's about it. But you're the constituent. You're the ones that really need to be having these relationships. You need to back me up. Because when I walk in, I'm representing you. And hopefully when I'm going in there and I'm representing you, the second I walk in, that senator or representative says, here's Antonio, he's from OPA, and now all of a sudden I think of all those pharmacists who are going to be mad at me if I'm not listening. So please, please, please get involved. Talk to me afterwards if you're interested in getting involved. I will not abuse you. I do it to Ray sometimes. I mean, I probably AJ too much. But I will plug you in, I will get you used to the process, and at the very least, start a conversation with your legislators so that you can start educating them about the issues that I'm talking about. And if there's things that we're not doing that you'd like us to start, talk to me afterwards. I'm happy to talk to you and address any issues. So thank you very much for being here today. Just you being here is a step in the right direction, so thank you.
One thing I'd like to comment on here is regarding what's going on with when you're talking about the immunizations. And as I get older and older, I keep catching myself saying, well, in my day, But I think back is that before us as pharmacists got the legal approval and the training to administer immunizations, I remember back when the flu vaccines every year was, you'd see notices in the newspaper or on television that there's going to be a flu clinic in the basement of St. Mary's Church on Saturday from noon until 4, and at the firehouse on Tuesday evening from 6 until 8, and it was very, very haphazard. If you didn't have, to spend the money to go to the doctor's office to get an appointment and a flu shot, or you went to one of these very random things where volunteer nurses were giving flu shots, it was very, very difficult to get a flu shot. So when pharmacy became legally allowed and trained to give immunizations, this all opened up a tremendous improvement in public health by the fact that our profession took ownership of that. And I think that we can only do more of that as we get more involved with more immunizations. I have a number of people who tell me it's very tough to get immunizations. There's a lot of doctor's offices that don't want to deal with it. So I think that's a step in the right direction. So I appreciate that. Thank you. Okay. Next on our agenda is Ohio Senator Joe Schiavone. Senator Schiavone represents the 33rd Senate District, which encompasses all of Columbiana and Mahoning counties. So I guess I voted for you in the past on here. You're in our area. In 2013, Senator Schiavone's colleagues unanimously elected him as the Democrat leader of the Senate. He's a graduate of Boardman High School, attended Ohio University in Athens, and received a bachelor's degree in communications, and then his Juris Doctorate from Capital University School of Law in Columbus. Senator Schiavone likes to remain active in the community. I know we see, I see a lot of you. We see a lot of you around. We appreciate that. I see here his wife Margaret is a nurse anesthetist, residing in Boardman with their son Louis and expecting a second child in May. And with your wife as a nurse anesthetist working in hospital pharmacy practice, I know the two areas that we have seen